Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. Before we dive into this powerful episode, please remember to subscribe to our channels and give us a 5-star rating on iTunes to continue hustling. This episode is brought to you by Excite Medical and the DRX 9000, Chiro HD, Softwave, Cool Blue VA, Bridge Financial, 100% Chiropractic, Chiro Health USA, ChiroScript AI, Chiro Moguls, the Chiro Speaking Company, New Patients in a Box, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, Pro Hockey Chiros, Pro Baseball Chiros, and the IFCO. You can benefit from a full list of sponsors by visiting our sponsor page at chirohustle.com/sponsors. Links in the description. Now, let's hustle.
Hey guys, welcome to episode 652 of the Chiro Hustle podcast. I'm your producer, Luke Millette, and here's your host, James Chester.
So today we have the opportunity of interviewing Dr. Chris Gubbels. And if you want to hear our conversation about Scoli-care and Chiropractic BioPhysics, stay tuned for the full episode. Welcome back. This is another episode of the Chiro Hustle podcast. Today I have a fellow Coloradan on here with me, Dr. Chris Gubbels, coming in from the Front Range. I'm on the other side of the state, which they call the Western Slope, but we're about 6 hours away from each other, even though we're in the same state. So I'm really excited to talk about Dr. Chris's journey, how he got into chiropractic, some of the advanced certifications he has when it comes to Scoli-care. I know he's a Scoli-care provider that a lot of docs will refer to him and co-manage patients with. He also comes from the same camp I come from, which is the Chiropractic BioPhysics world, which is the most researched, produced chiropractic group on planet Earth, which I'm really proud to say that I come from that camp with him. And then we're going to chat about him being a certified board examiner when it comes to helping the patient as a patient liaison support, which takes high level of expertise and confidence in what chiropractic does for the outcomes of patients' lives. But before we get into Dr. Chris's story and how he got into this beautiful profession of chiropractic, I'm going to let you know our big why. Why do we do what we do at Chiro Hustle? Well, first things first is freedom of speech. We protect freedom of speech with this show. We've never censored anyone. We know what it's like to be traffic throttled and shadow banned and all the things that are ugly in social media and the platform. So we would never do that to anyone else because we know what it feels like. We also believe in medical freedom and family health freedom. Anyone that has a family out there, they know that they're looking for answers and solutions for the longevity of health within their family units. I recommend everybody to go find themselves a neighborhood chiropractor and to get the advice from somebody that's a trained professional on what to do for your family and yourself when it comes to medical health care and medical decisions. Bit more philosophical, we do believe in protecting BJ Palmer's Sacred Trust. If you don't know what that is, go to the show notes and find that on chirohustle.com. And you're going to find out more about chiropractic than you previously did, I guarantee you. Even if you've been practicing for a decade, go read BJ Palmer's Sacred Trust. We support subluxation-centered chiropractic. We believe in innate intelligence and universal intelligence. We believe that when man or woman, the physical gets adjusted, it connects them to man or woman, the spiritual. I know that sounds like some woo-woo, but we have to mention these things because they're removing philosophy from chiropractic colleges stateside. So if you have access to a chiropractic student, please share the show. Share the show with the future chiropractors because what we talk about here is real deal chiropractic. And with that, Dr. Chris, welcome to episode 652.
Oh, thanks for having me. I'm excited. It's my pleasure.
Yeah, so the chiropractic story. This is a chance for your friends, family, colleagues, patients to get reacquainted with you because I'm sure that they know that you're an on-fire chiropractic warrior, supporter, practitioner, but they might have lost the story that you live for and why you do what you do. So if you can share to them and reintroduce yourself, if you will, as to why you decided to become a chiropractor.
Well, it started when I was wrestling in college and I hurt my neck, and it was something at the time, it was pretty severe. I mean, I had a hard time getting out of bed and getting dressed on my own. And I always say they cooked me, they froze me, they electrocuted me, they pounded on me like a piece of meat. I mean, I got ice and heat, and I got medication and stem and all kinds of stuff, but nothing was helping. So my wrestling coach referred me to a chiropractor, and I went there, got adjusted. I could work out. I got adjusted again the next day, and boom, day 3, I was actually competing. So I knew I wanted to do something in healthcare, and that was something where I saw dramatic results. And so I started looking into the chiropractic field. Plus, I kind of had an entrepreneurial spirit about me, and it was something I saw that you could really do your own business in. And actually, 4 of my wrestling buddies from college actually ended up going to chiropractic school because we used it so much in college just to keep us going. But that's how I got started initially.
Well, a lot of people that listen to the show, they know my story as well. I actually got into chiropractic as a patient when I was 16 years old because I hurt myself playing high school football. And my athletic trainer suggested that I go get some x-rays with my mom at Palmer College. And they x-rayed my shoulder, but they also asked my mom at that time, this is when I believe that they were still like high on philosophy. They asked my mom if they could x-ray my spine to see if I had any spinal subluxations. And that's kind of how my career started, understanding this chiropractic world growing up in Davenport, Iowa. I didn't realize how powerful that was, knowing that Palmer College was right across the street from my high school.
Oh, wow.
So, a lot of times I find that people have these athletic journeys and they do something, they tweak their neck or back or hip, and somehow the athletic trainer or somebody within that college says, hey, you need to go try chiropractic.
Yeah. Yeah. I mean, people get in for different reasons, but I think it's nice when someone has a story that kind of lit a fire in them or created a calling for them versus showing up and, that seems like a good career. I think I can make some money and I like to do something in health. Not saying that can't be someone that becomes a great doc, but you do see a lot of people that have had their own story that led them in and I think they have more conviction sometimes as far as what they're doing and why they're doing it.
Yeah, and I think it's really cool that you had a group of guys that were all wrestling together that went on to become chiropractors.
Yeah, 4 of us. I mean, it's a good feeder program, I guess, for chiropractic school.
And as you have matriculated into the practitioner you are today, let's focus the next part on talking about your background in chiropractic biophysics, and then we'll get into the Scoli-care model that you're practicing mostly today.
Yeah, absolutely.
So how did you decide that you wanted to get, after 7 years of college and getting your undergrad and then getting your doctorate degree, how did you decide that, hey, I want to sign up to get probably the hardest postgraduate distinction that I can get and learn chiropractic biophysics?
Well, I think it started when I was doing like my preceptorship in Wisconsin, and they were learning Pedibond. So I went and learned all the Pedibond. I started telling the doctors, because I was the one that did the most training, here's what we have to do for the rehab. So I started off in Pedibond right out of school. But I mean, with that, we got some results, but it wasn't everything I wanted. And I'm not the kind of person that wants to go to a rah-rah seminar to feel good and put fluff on it. I'm more the kind of like, I want to know, do I have the solution, and what's the solution? This is the best thing for them. I want to have absolute certainty about what I'm recommending and what I know I can do or can't do, and what's the best thing for the patient. So I had a friend invite me to a CVP annual seminar, and it was the first conference or seminar after Dee's dad died. And I went there, which is we do an annual research seminar every year. And I'm sitting there and I realized, like, I really don't know squat about spine correction. And I felt like everyone was smarter than me, and it was very daunting. I was just getting going. I was probably only a little over a year and a half in practice. I didn't really know much. I didn't have 2 pennies to rub together, but I knew it was the right thing. And so I just got started. At the time, I remember like buying a basic textbook was like, do I buy that or do I have lunch today? And that's where I started. But that's what I always had the drive to just want to be able to give people the absolute best recommendations with certainty I could deliver. And I saw CVP had the best research and the best methods to actually make predictable and reproducible results that we knew could impact patients. So to me, it was an easy yes, just to keep going and showing up and starting on that path to becoming an advanced certified CVP doc.
Well, I have seen plenty of guys just like you early on in their careers showing up to seminars, no nickels to rub together. And they're saying, do I buy this training from this person that tells me that they're going to help me grow my practice by 50 patient visits a month? Or am I going to sign up for the next like coaching group? And I think that there is a huge thing when you are looking for guidance. You want good leadership and you want to invest in something that's going to give you certainty and produce results. And I think that because you did that, now you have yourself fundamentally squared away to where you have certainty in the practice model that you're doing today. And that's being the Scoli-care provider. So you took the building blocks of your college degree, paired that with the advanced certification within chiropractic biophysics and learned all the curve correction stuff. And now you're saying, well, what's next? And I think you're there.
Well, so I think it was in 2014 or 15, there was a new course that CBP was putting on for scoliosis. And we had scoliosis patients. We can get some results, but I knew there was something missing. And I still was confused about exactly what to do and the best way to treat them. And there was another clinic in town that said they did scoliosis work, but I wasn't certain that they had the solution. So I showed up to this seminar. There's a guy from Australia talking, and he's presenting and he's asking us questions. And me and everyone else, it was the first time they presented this seminar. We're like, oh shit, we don't know squat. Like, it was one of those things like, please don't ask me out loud because I don't know, I'm guessing. And it's one of the same talks I give the docs now all the time too. But they had new technology and advances, and I could see a path to get really high level learning, and I could see a need in patients. And so the opportunity was there. So I was excited, and I came back and started doing, it's a scoliosis bracing, but it's based off of CBP principles where we actually hold the patient in a mirror image to change how their spine grows, which is completely different than traditional braces a hospital does, where they're trying to hold them like a cast and just hope they don't get worse. So it's a complete different concept, and it's bracing using the thought process like we do in CBP to put the patient in the corrected position. So that's how I got started, was actually through a CBP.
Well, I think that it's really revealing to you to say, hey, I got into this one part after getting my degree and I don't know anything about this. Teach me more. And now I got into this other part. I don't know anything about this, but hey, I'm going to admit it. Teach me more. And I think that that says a lot about you as a practitioner, that you're willing to, like, you know, my best teachers in the world would always say, if somebody asked them a question, if they didn't have the answer to it, they'd say, I don't know that, but I'll find out and tell you.
100%.
So I think that that says a lot about your character when it comes to producing the best results that you can.
It's so funny. I was talking to one of my friends who's a colleague and is actually the head researcher and trainer, education trainer for Scoli-care. And like when she got into it, she's like, I had one patient, I thought a mom wanted me help. So I went through all this training with the idea to help this one patient. And the next thing you know, that's what I ended up doing. And I kind of tick if there's a patient that comes in and there's a solution, and I know the solution, but I don't know it, I would feel guilty if I didn't go figure out how to help them, if that was the kind of people I wanted to treat.
Well, health is like a giant jigsaw puzzle. Like if you're putting the puzzle together and you're missing pieces, you got to figure out how to put those pieces into the puzzle. And I think that you can talk subjectively to people. You can do their soap notes. You can do the adjustments. You can keep good, you know, plans for people. But until you start finding out how to crack the code for correction, you're not really producing the best that you can for the patient. So I think that there's a lot when it comes to patient retention, but it also comes a lot to, you have to be an active participant in the model that you practice. Like you can't just cancel your appointments. You can't just not show up for 3 weeks. You can't just say, hey, I want to start care and I'm only going to come 1 day a week for the next 9 weeks. Like it's not an option. Like people have to like be all in, like from soup to nuts when it comes to like becoming an ideal plan for them, because you're giving it to them your all, and they have to also participate with accountability all in. Otherwise they don't get the results.
Yeah, and I think that's probably even more so true if you think about a patient that has scoliosis, because generally speaking, they're going to be dealing with this their whole life. But getting the right treatment at the right time versus the wrong treatment or no treatment is going to make a big difference in what their life looks like. And so when people come in, and then literally, even if I have a child come in, I know what we do and how we do it, and their participation in it literally is going to dictate the quality of their life. And everyone says that, but it can mean the difference between having a life where they're enjoying doing what they want to doing versus being disabled because of chronic pain or having to get surgery. I mean, if I get a child, it's either generally let's get the job done or surgery. That's the stakes on almost 100% of the cases that come in. Or in adults, it's like let's help them, or they're just living a life of disability, and that's like poor function, poor quality of life.
You made it to Chiro Hustle. Sit back and learn from the greatest influencers in the profession on the world's #1 chiropractic podcast. This episode is brought to you by Excite Medical and the DRX 9000, Chiro HD, Softwave, Cool Blue VA, Bridge Financial, 100% Chiropractic, Chiro Health USA, Chiro Script AI, Chiro Moguls, the Chiro Speaking Company, New Patients in a Box, Pure Chiro Notes, Titronics, Sherman College of Chiropractic, Life Chiropractic College West, Pro Hockey Chiros, Pro Baseball Chiros, and the IFCO. You can benefit from a full list of sponsors by visiting our sponsor page at chirohustle.com/sponsors. Links in the description. Now, let's hustle. Well, I was out doing a marketing event for one of my clients this weekend, and this gal comes up and tells me she has scoliosis. Mm-hmm. And I'm like, so what are you doing about it? And she's like, oh, I get massage and I try to do some stretching. And I go, well, I'm not a doctor, but I'm going to tell you this. This is how much I know, that if you don't do anything about it, it doesn't get better, number one. And what it's doing is it's twisting in a pattern that is contorting your fascia that controls all function and mobility of your trunk. And when you lose functional mobility of your trunk, scar tissue sets in and those discs starts rubbing down on each other. So it actually fuses your spine together, crushing the nerve supply going to your organ system. And that's just the start of it. So yeah. I said, you might want to find somebody that can really take care of your scoliosis, because I've never met anybody that didn't advance or get worse with age. So I go, I would take it very serious and find somebody that's specific with helping patients with scoliotic shifts in their spine, mm-hmm. because you want to have a quality of life and you don't want to be disabled when you're 30 years old.
100%. And even you hit something really interesting, because when the vertebrae get out of alignment like that and they twist and they rotate, they lose, as you know, what's called the normal coupling pattern, but they instantaneously start to stiffen up. So they do start to break down, decay, and get scar tissue. And what's interesting, I think society has gotten to the point where a lot of people are almost brainwashed into thinking, I don't have to do anything until it's gotten bad enough. It's like if you go to the hospital, it's like, well, it's fine. Let's just put up with it. And then if it's the spine thing, a lot of times it'll say, put it off until you can't take it anymore, and then we can talk about surgery or whatever. But they don't do that if someone has high blood pressure or high cholesterol or whatever. They say, oh, you take this or take that. There's a really good book. It's called Outlive, by a really popular guy. I think it's Peter Attia. And he talks about more medicine 3.0, where if we know where something is going, why would we wait to address it? Why would we wait till it's an emergency? Because what we do when someone is 20 or 30 is going to determine what life looks like when they're 40 and 50. And what you do when you're 40, 50 is going to determine what does that life look like when you're 50 and 60 and 70. And if you take the right action early on, first of all big problems start as small problems. They only go one way. But what you can do for that person long term depends on what you do in the moment. And so the earlier you start doing the right thing, the better the future looks like, as far as not only what you can do, but what's possible too.
And this takes me back to the boots on the ground work that I do. I go out and I talk to people, and somebody says to me, well, my kid's only 10. He doesn't need chiropractic. And I'm like, well, this is my philosophy and you don't have to adhere to it, but it's easier to make healthy children than to fix broken adults. And it makes sense to like mom and pop that are just out there in the free market looking for a solution. But they're like, I would never bring my kid to the chiropractor. They don't have any problems yet.
Yeah.
And I can't tell you like how much work we have to do on public perception as to why people need to take care of their children with chiropractic services and not just wait till they're 20 years old and they can't go do their job anymore because their low back pain is like screaming and they have sciatica. Like that's what happens is when we don't give maintenance care to a developing kid, because that's really when we have to start this program. That's really when people have to start stopping the progression of scoliosis.
Yeah, I mean, when we had our baby girl, I told my wife, like, I don't specialize in infants, and I know there's doctors that are ICPA advanced certified, and I did part of that program to know they have specialized training. So we took our daughter in the beginning to a doctor down the street that had advanced certification in treating pediatrics, because I knew there was things she could do beyond what I would just know to look for. And when she brought her in, and she was like, well, why did you bring her to see us? I'm like, well, I can work on her, but I know you're better at this particular person than I am. This is all you do. So
yeah, and that kind of takes me to my next stage of questioning for you is marketing. Like, I'm sure there's lots of docs that will watch this and be like, well, how does he grow his scoliotic? How does he grow Scolibrace in his office? And I think if you could just glean on some examples of how you're working interprofessionally and how you're helping people co-manage cases, that would be a great segue for us.
Well, we get about 50% that come directly to our office by searching us out, but right now, the other 50% comes from healthcare providers, and the majority of those are actually chiropractors. And we don't know, but generally what happens is when I get up and I teach and I present on scoliosis, I teach a lot of doctors. They understand there's always a role for chiropractic care for a chiropractic patient. There's always health benefits. There's a ton of things we can do, but we also know there are things that a traditional chiropractic adjustment cannot do for scoliosis. And because the spine actually grows deformed, and that needs special type of care. So in our clinic in Denver, we don't do any traditional chiropractic. And part of that design is because we know most of our referrals are coming from chiropractors. So when we find chiropractors that have a patient that they think they need help with, they can send just for a free case study where I will tell them if they don't need any outside help. They can do a case review, they can send their x-rays, they can message me. But if they do need outside help, they always stay their chiropractor. But we may be doing scoliosis specific stuff. We'll co-manage with that patient. And even in my clinic in Fort Collins, where we do chiropractic care, we have a strong policy that we will not take on a patient as their chiropractor when they are referred by a chiropractor. They are always their chiropractor. We will co-manage with them doing the scoliosis work. It'd almost be like if a dentist and an orthodontist a patient, you're still the dentist, they're just doing the orthodontic stuff. So it's almost that relationship.
Well, I love that approach so much because it proves that there's no scarcity in patient care and that there's plenty of people to take care of, and that we should have interprofessional relationships, and we should find out people like you found for your daughter, somebody that's advanced certified in pediatrics to take care of babies. And now we know that there's certain levels of distinctions within chiropractic that people will start seeking out the right providers for the right cases.
I was just talking to a lady yesterday that's in my area, and I introduced myself, and she's like, oh, we don't get a lot of scoliosis patients, but we get a few. But then I was asking about them, and they do some really advanced stuff with functional medicine, and not just a quick program, but on a high level. But I'm like, that's so great to know, because I don't know someone in this area that does that. And I can tell even in our area, I've had to start finding docs that I feel good about in each area of Denver, because we get patients that literally call me, do you think I should be doing chiropractic care? I was like, absolutely. We don't do that here. Where are you at? If you don't have someone, I can help find you someone that would be great for you to go get adjusted by.
And I think that that's the power of this profession. We just are, I think, in a chapter of the profession where we need to focus on that more. Instead of saying, hey, I catch all cases.
Yeah.
Like I want the
You catch all headaches.
I want all the people. I want the Medicare people. I want the pediatric people. I want the car collision people. Like, I think that that's the hardest type of practice for people in this day and age to actually run. because they have such a different quality of caseload that not everybody is getting exactly the type of program that they need. And just because they're like, hey, I need to see 500 a week, it doesn't matter what type of care they need. I'm just going to see 500 a week and they're all going to get adjusted the same way. And I know that I have to hit high volume numbers. Otherwise, I can't make money in this profession. So I think it is really cool to see that there are distinctions within chiropractic, that if you get yourself positioned the right way, you can then offload the cases that aren't congruent with your practice style to the right type of practitioner.
You know, it's interesting. I remember sitting with one of our consultants. Is one of those things where you're going through an exercise and you're really trying to figure out what can you do better than anyone. And then my mind just kept coming to scoliosis, and I'm thinking, there's no freaking way I am going to do nothing with scoliosis, because scoliosis is hard, and the patients are challenging, and they're desperate, and they come in, and you're the last hope. But I'm like, I got to the point. I said, maybe I just need to get better at this. And so we got to the point in my clinic in Fort Collins where the only thing I did was these scoliosis patients. And once we made that change, that was the only thing I did. We got better results. It got easier, and that's my only focus. And so there's a power to that. And there's nothing wrong with being a family practitioner. You can help a ton of people. It's like whatever you want to do. But there are specific things that if you're going to take on those patients, you really better know what you're doing at a high level, or you're drastically disservicing the patients. And I see inaccurate things stated all the time and said all the time. People ask me things, and but in the end, the patient's going to find out if you're able to deliver the goods that you say you can.
Well, that's why I love your associations with high level practitioners that come from the chiropractic biophysics world, because you can tell the difference in the way somebody takes care of somebody based on the results that they get. And I don't care how many seminars you go to or how many adjustments you do. If you don't get the person that's on that table the results are looking for, what you're doing is ineffective.
Well, I remember going to a seminar, and sometimes I go to seminars and Dee would speak, and he'd point out me and some other guys to talk to if they want to learn how to do CBP. And the number one thing people would say is, this sounds really great, but it seems like a ton of work, and I don't know how to make it work in my practice. And I guess my viewpoint is like, well, what do you want to, what's your goal with your patients, and what's the outcome you want? Like, what do you want to accomplish with your patient? And then if whatever that is, well, then whatever you have to do that, don't worry about it. It's like, that's just what it takes.
Focus on
saying, well, I want to be really healthy and in shape and great fitness, but I don't really want to work out. I don't want to eat good. I don't want to go to bed and take care of myself, but I really want to be and have great health. It doesn't work that way.
Yeah. One of the greatest moments of my life, I got a chance to spend 2 hours with no one else but just John DeMartini and myself.
Yeah.
And he just paid attention to what I was saying. And he gave me this brilliant analysis at the end of it. And he said, you know what, James, no one else is going to give you permission to be great. He goes, you got to quit looking for people to clap for you. You got to quit looking for people to support you. You have to just go and put the work in every day and make the guy that looks in the mirror back at you really proud. And I think that that's my best advice to anybody that's at that catch-22 analysis of, I don't want to do the work. Well, the work's got to be done. Otherwise, you live a mediocre existence.
Yeah, that's it's interesting. And I get asked sometimes how this transition went to being a scoliosis only clinic. And, I was in practice 15 years, and I never got to the point where I could get my clinic to be 100% independent without me. But I went to Australia and I hung out with the Scoli-care team. That's where the headquarters is out of, and spent 2 weeks with them. And I just saw, like, this is all these people do, great environment. And I was like, you know what? I could see what we could do, because that's one problem. We can be the best. And Scoli-care is the best in the world. Like, a lot of people like to say that, but they literally deliver the best in the world internationally in this space. And I had an opportunity to focus on that. And we were down there, my wife and I were on a train going somewhere, and I turned to her, I said, I'm going to do it. I'm going to open the clinic. I'm going to sign the contract. I'm going to do it. And about 30 minutes later, she's like, you sure you're going to do it? I'm like, I told you I'm going to do it. I've already decided. But once I made that decision, I knew I was going to do it. And I told him, I said, I have to figure out how to get my other clinic to run without me first. But when I had that purpose, I was able to do something in 6 months that I couldn't accomplish in 15 years because now I had a why, because I was going to do this clinic and I had to find a way to keep my other clinic going, take care of my employees, keep the thing growing, keep the delivery going. But I think it was that purpose of knowing this is the right thing to do that really drove me to figure out how to do it.
Well, me as an outsider looking in, just being your friend and getting to know you over the past couple of years, I'm really proud of you. I think what you've done is exceptional when it comes to putting all the pieces together and being driven and focused and not losing focus of your North Star, and just keep on going forward to it. And I think that that's really something that inspires. And like, that's why we do this show, so we can share these stories about people that are in the trenches, as chiropractors say. But when you're doing the work, a lot of times people don't get a chance to glean on how you've done what you've done and achieved where you're at today. So these stories are invaluable to not only you, but your practice members, to the future patients that are going to Google Scoli-care, and this interview is going to come up because we tag it the right way and we produce it the right way, and eventually people are going to link onto this interview for the next 20 years maybe, and they're going to see that there is an option for them with their kids and with their families to work on this malformed spine that they have that they call scoliosis. So I know there's some more questions that I really wanted to talk to you about, but I think we're at the edge of our time together today. Yeah. I would like you to close this out with a miracle story. Share something with me that you've seen over the course of your career that you think might inspire some people out there.
First thing that I thought of was a patient that came to see me who had scoliosis. He was at a surgical level, and he was going to some other place and doing treatments, and he wasn't really seeing the results. But then it happened in college. He had a rock climbing accident where he fell, and his scoliosis advanced and got worse because of the big compression during his fall. So he started coming to see us, and he was kind of, he was in fear. He was a college kid, and he's told he has to have surgery and nothing's going to help him. But I explained to him the kind of bracing we were going to do that would hold the spine in a more correct position and keep the spine from collapsing. And it's right when we started doing Scolibalance, which is a method of scoliosis rehab, combining a few of the best methods and taking the best part and combining those, that he enrolled in that. And we actually reduced his curve actually just below the surgical thresholds. But more importantly, he was pain-free, he was confident, and he was going to undergrad at the time. And then he started talking about, should I go be a PT? Should I maybe go to be a chiropractor? And he came to my open house, and he was there, and I asked him to share his stories. And I mean, he wants to be in healthcare and he wants to work in scoliosis, and he's actually going to start coming to my clinic in Fort Collins as an intern just to be involved, because he saw something that he was struggling with and he didn't know where to find help. And he saw what we were doing and literally what kind of care we provided. And he realized, this is what I want to do with my life. And he's in tears when he was telling a story. And I think there wasn't a dry eye people there listening to him at our grand opening in Scoli-care Denver. But that's someone that I'll never forget, that was looking for help, and he had been trying and searching, and he came in and he saw like the light for him and what it could do for him, and in turn inspired him to dedicate his life to treating patients or helping people just like himself.
Well, I think that that's profound, and we need more advocacy out there. And we need people that are willing to tell the story. That's really why I started this podcast 7 years ago, because I was at a Mile High chiropractic event 10 years ago, and I saw a guy named Joe Borio on the stage telling every chiropractor in the audience, you have to go tell the story. You have to go tell the story. He must have said it 100 times during his talk. And I said, a light switch flipped on inside of me. And I was like, you know what? I have to tell the story. And I think that it's profound when it comes from the voice of a non-practitioner. And I think that more people are looking for solutions for their health concerns. And I tell people this all the time. Most people just don't know where to go or who to trust, and they don't know that their concerns can be a solution with chiropractic. And I think that if everybody just started referring to chiropractors for all concerns with person's health, we'd have a higher quality resonance with people's tone of life, and their posture and their balance and their longevity. And when people have healthier spines and nervous systems, they have better adaptability. It's proven. Research tells people this. So I think that's a brilliant send-off story with a testimonial from a miracle story that you've seen. And I hope that he still keeps on doing the work, and maybe he'll come out and help me do some work.
Yeah, maybe. Yeah.
Well, with that, is there anything I didn't ask you that you'd like to share with our audience today before we call it a night?
Well, I get a lot of docs that want to know, what do I do if I maybe have someone, I might need some help, I'm not sure what to do. Just at Scoli-care, you can always reach out to me, follow me on Instagram or Facebook. You can always message me, but we do a free case review, and that's to help doctors understand what's going on, how to properly evaluate the case. But if they're not sure what the patient needs or what's the right action to do, you can reach out to us and we'll give you free advice on how to approach your cases. And if we think they need more advanced care, we're going to let you know. If we think they don't, we're going to let you know that too. But we're there to assist you and help us. So we're a resource for docs. And so if you ever have questions, need help, don't hesitate to reach out.
Check him out, Dr. Chris Gubbels on Facebook and Instagram. Go to Scolicare.com/Denver-Colorado, and you guys can get these case reviews with him and his team. Dr. Chris, thank you so much for being a part of the Chiro Hustle family. Your episode 652.
Awesome. Thanks, James. Appreciate it.
Yeah, let's share this with everybody. And if you guys made it to the end of this show to where we are right now, like I said earlier in our introduction, please share the show. Share this with chiropractors, share this with students, and let's inspire more people to get into the chiropractic lifestyle. And with that, you're just one story away, guys. Keep hustling. I'll see you on the next episode. Bye for now. Thanks for listening to Chiro Hustle. Don't forget to subscribe and check back next week to continue hustling.